I'm Leeba Lessin. I'm the president of CareMore. The CareMore model is really based on three premises. One is that to the degree that patients understand their disease, understand all of the things going on in their body, the more they understand, the higher the probability that they'll have a good outcome. The second premise is that in an average daily primary care practice, where a primary care physician has 5 to 10, maybe 15 minutes to spend with a patient, it's absolutely impossible for all of the things that I just described to happen. Thirdly, it's very important to recognize that healthcare in general is the sum total of clinical care, behavioral care, social support at home, patient education, nutritional care, and so forth. There's a handful of insights from the way CareMore thinks about things that would be transformative to the American healthcare system. One is that a team of clinicians, including a physician, but not only a physician, who can dig deep into the details of a person's clinical, social, behavioral, and pharmacological world and manage those together is our best shot for preventing long-term catastrophe. In the Medicare population, 15% of Medicare beneficiaries consume 75% of Medicare costs. We think that actually the trick to reducing that number dramatically is actually to apply a lot more resources to the other 85% who are aging and emerging into chronic conditions, keeping those patients stable, avoiding the big catastrophic events that happen in that big 15% swing. And that is the trick, in our opinion, to saving the Medicare system. One of the things we think about all the time is how do we use all the electronics that are all now in most of our homes and fingertips to improve patient care. There's a fairly natural extension of the kind of team-based medicine that we've been talking about and the electronic things that we've been talking about, and take them into people's homes with the exact same principles that we operate with the rest of CareMore. Provide maximal support to stabilize a patient, keep their conditions under control, their symptoms under control, avoid big catastrophic situations. One of the greatest satisfiers for me in my job is hearing doctors feed back to me that they're practicing in a way they would not have imagined. Every CareMore clinician, every person who supports those clinicians has to be really passionate. I love seniors, and I have a lot of compassion for what it looks like for life to slow down. I have to say I love seeing our team thrive, and that just makes my day. And I love it to death. I couldn't think of a more perfect job.